Hello friends, welcome to a new lecture today. Now I would like to discuss about the fracture of head of radius. Fracture of head of radius. So this fracture of head of radius occurs in adults and it is a valgus injury. It occurs in adults and it is a valgus injury. Okay. So why does this occur? This occurs due to some trauma. Okay. Here, whenever there is trauma to the elbow joint, then the head of the radius can become fragmented, and that leads to fracture of head of radius. It is of different types. So mainly it is of three types. Okay, where in the first type there is just a crack. It can be in any place. There can be just a crack. Okay, there is just a crack. It is not displaced. Okay, there is just a crack only. Okay, there is just a crack. There is no displacement, nothing. That is type 1. Presence of crack only, that is undisplaced. Okay, the second type is the head which is there, that is broken off. Now, okay, if this is the part, then the head is broken off. That is, if the head which is there, that is a part of head, not the complete head, a fragment of head, that is broken off. That is here, a fragment of head is broken off. This is again divided into two types. What fragment of head? If this fragment is smaller one, that is if this fragment is less than 1/3, that is one type, fragment less than 1/3. Okay, the second type is the fragment which is there, that is more. So the fragment is more than 1/3 of the head. Okay, this is fragment more than 1/3 of the head. Okay, then the third type is comminuted fracture. It's not a one fracture, but it can be 3 or 4 fractures. Okay, so this is called as comminuted fracture. Comminuted fracture. So these are the different types of fractures. So the fracture head of radius, it can be divided into presence of only crack, it is not displaced, and presence of fragment which has head is broken off. But if this head, the part of head, not the whole head, part of head is broken off, and that part which is broken off, if that has a fragment which is less than 1/3, this is like this. If it can be more than 1/3, then it looks like this. Then finally it can be comminuted type of fracture. Now, how are you going to investigate this fracture head of radius? In fracture head of radius, you can investigate it first. Before investigation, first, let us learn about the clinical features. The patient comes to us with a history of pain in the swelling. Pain is seen and there is a swelling is seen, and on examination you will feel that there is tenderness and pain which is there over here, that is really mild. So as a result, many a times this fracture is missed. Remember that mild pain and mild swelling. So as a result, it is missed many times. So you'll have to remember that, and you will feel local. The patient will feel local tenderness on the head of radius, located immediately distal to lateral epicondyle in a semi-flexed elbow. You will also see painful forearm rotation. Next, how are you going to treat it? The treatment depends upon the type of the fracture. See, first, when there is only crack and it is not displaced, whenever there is only crack and it is not displaced, then you will have to do immobilization. How are you going to immobilize it? Immobilize it in an above elbow slab. Okay, this is immobilization. In an above elbow plaster slab. Above elbow plaster slab. Okay, for 2 weeks. And then you will have to see the position, and then you will have to do exercises. Remove the plaster and start elbow exercises. Now, next, if the part of the head is broken off, and if this broken off part is this broken off fragment is less than 1/3 of size of head, 1/3 of size of head, in such cases you will have to do immobilization. You can do immobilization, and you can do immobilization with the help of above elbow plaster slab. Now, if the fragment is more than 1/3 size of the head, in such situations you will have to excise it. You cannot do anything but excise it. If it's a comminuted fracture, even then you will have to excision of head. What are you going to excise it? It excision of head. You'll have to excise the head or excise the fragments, complete fragments. Okay, so this is how you will treat the fracture of head of radius. Now, what are the complications of this fracture of head of radius? The main complications of this fracture of head of radius is joint stiffness. One, because of this fracture, there is limitation of movement, and slowly because of limitation of movement there is development of fibrosis, and that causes joint stiffness. So that is one thing, and it can also cause osteoarthritis. Okay, so these are the two different complications of fracture head of radius. So thank you guys for watching my lecture. Thank you.